Hello, it's Dr. Christine Arseneau, PharmD Functional Medicine Certified Health Coach, and wanted to talk about emotions today because emotions were such a big part of my healing, and I had to become aware of my emotions and realize that I even had them in order to heal. So I feel like in the household that I grew up in, emotions weren't really acknowledged. They weren't really okay. It was like, oh, don't be sad, don't be angry, don't be this, or you don't feel that way, where emotions just weren't acknowledged. And so I never really learned how to express my emotions, how to even feel my emotions myself. And I think that really led to me struggling for so long with Lyme disease and not being able to get well. And I just kind of stuffed things down. And even just the way that I grew up, my dad was in the army, and he had to go away to war when I was young, and he wasn't there on Christmas, but it was like you weren't allowed to complain because you knew he was there for a bigger mission. So it felt like you weren't really allowed to have feelings around it either. And so I learned to kind of suppress my feelings at a young age, and it wasn't until I really started going to therapy and exploring and bringing things up that I got to a place where I started to see real shifts in my healing. And for me, that meant talk therapy and a lot of crying. But it doesn't have to be that way. You don't have to relive things. There are different ways, because emotions are just energy. They're energy in motion. That's what the definition of an emotion is. And so if you learn how to allow those to go through you, and you learn how to shift those, and you become aware of emotions and beliefs that you have, then you can make changes instantaneously. And so I think, I really kind of shoved some things down there. I had a miscarriage, which was pretty traumatic in that the fetal cells stayed in my body and started replicating. It's this rare form of cancer that can happen after a pregnancy. And I had to go through chemo for that. And I just kind of kept pushing through, and never really took time for myself, never really properly grieved or gave myself that space. And then that relationship ended. I was in an engagement and we canceled the wedding, and then I had meningitis not long after the whole miscarriage thing, and I had a lot of things in my health, and I didn't always really feel my emotions and express my emotions and allow myself to sit with my emotions and process things. And we do this in our society. We numb ourselves, we distract ourselves, we're always on our phones, or what video games or movies or social media or whatever it is. It's easy to distract yourself and not feel things. And emotions that are stuck in your body cause actual physical symptoms. Dr. John Sarno is one of the doctors on the forefront of this, and he's got some really good books out there, and he talks about emotions and how when they are stuck, they cause oxygen deprivation, which causes pain. So they lead to actual physical symptoms in your body. And he helped people with back pain, with all kinds of things, by just having them realize that their emotions were part of it, and how the whole mind, body, spirit connection, and how that's not just like a woo-woo thing, that's actually affects us on a physical level. And so you don't really have to do anything other than become aware of the emotion. He was able to help people with back pain and different things by just having them realize that their anger for their father or something like that was contributing to their symptoms. And for most people, just having that realization is enough to let it go. And so I just wanted to share my story of how I was able to let go the sick version of myself. And part of that process was becoming aware of a subconscious belief that I held. And it was my reason for staying sick. And so there's reasons for us to stay sick. And I'm not saying that it's in your head or you're doing it on purpose on a, conscious physical level, but subconsciously there's reasons that we choose to stay sick. There's some benefit that we get from it, some attention that we gain, some reason that it benefits us, and that makes it harder for us to let go of that sick version of ourselves. And so for me, it was the subconscious belief that being sick made me closer to my mom, that was the only way I could receive her love. When I was younger, we weren't big on emotions, and I think when I was sick was really the only time I felt loved and cared for. And it was as if I was staying sick for my mother's attention, which when I had that realization, I was actually appalled by it, and I didn't want to believe it. And I was like, my mom doesn't even believe that I'm sick. She's like telling me that doctors are just telling me what I want to hear, and it's in my head. So how could I be doing this for her attention? Like, I didn't want to believe it consciously, but subconsciously I just knew, like, wow, that's that little girl in me that just wants the love of her mother. And I continuously had these health things that kept coming up, and I was always just more sickly and sensitive to things. And well, because I had Lyme this whole time, but also the dynamics for that reason. And so when that subconscious belief surfaced, I was able to just completely let it go because I was now aware of it, and I released it energetically. I actually vomited. There were plants involved that facilitated this, and I vomited the old version of myself out into the toilet. And there was this distinct moment looking at the toilet bowl where I was like, I am fucking done. I'm done. I'm not a person with Lyme disease anymore. I am healthy. I'm done. I'm not seeking the attention of anybody. I'm not staying sick. I am a healthy person. And of course, there was multiple other things I did on a physical level, mind, body, spirit level until I got to that point. But I got to that point and I just knew I was done, and I just let that sick version of myself die. And it was like a switch that flipped, and I just knew that I was well, that I was a different person, that my genes were different, I felt different. There was no way that I could go back to that other person. Like, it was distinctly different. And yeah, those emotions, they keep, they're a part of our life. They keep coming up, and just now I realize how affected I am by energy and the energy of others. And so in my healing process, I put up boundaries, and I really limited the time that I spent with people, especially people that weren't serving me. And I made sure I only concentrated on those relationships that were nourishing. And I make a real effort to keep energy moving through my body because I realize it can cause problems for me. And so I feel my emotions, and I express my emotions, and I allow them to flow through me, and I keep my body moving. I do a rebounder. You energetically, you don't want things stuck. And so I found ways to keep things moving so that that doesn't happen. And, changes are instantaneous. And if you have a big epiphany, a big realization, a big awareness about a certain behavior, maybe it's a thought pattern or a subconscious belief or something, just being able to observe that and let it go can be just what you need to get to a huge new level in your healing journey. So I just want to make sure that you know how important our emotions are, and not to kind of dismiss that as not important for your overall health and well-being and healing. If I wasn't able to explore my emotions and really do some inner work, I don't know that I ever would have gotten to the place where I was able to fully heal. So I just wanted to share that today, and I hope you have a wonderful day.